the
So,
rotate too.
real quick, I'll introduce Greg and Ahmet. Giorgio is a CF adult out in Arizona and has been joining our classes. And Tiffany is the newest member of our, actually no, Rima is. Tiffany's one of the newest members of our team at CFLF. And
took my title.
and working in our programming. She's helping with, I think you guys have met Erin Evans, our program coordinator in the past. She has been having some health difficulties over the past year and is gradually going to be transitioning out of the CFLF. So Tiffany's working on taking over her role, and Rima is helping on our development pieces. So she's transitioning into the CFLF.
Okay, awesome.
And so you guys know Rima, but Tiffany and Giorgio. Greg is the pediatric doctor at Boston Children's, and Ahmet is the adult. You're at both Boston's and Brigham, right?
Brigham, right.
And MGH also? No, just
no, not MGH.
Okay.
Well, they're part of, Mass General. Brigham is a big conglomerate, and Mass General is on one side, Brigham on the other.
Got it. Okay. All right. So let me get this live stream set up on Facebook. And we had one other registrant that I don't know if he's going to join or not. So they can jump in. Okay. I'm going to hit the live button.
Nervous.
Not much will change. So good afternoon. I'd like to welcome everyone to the STROLO University. Today is May 4th. May the 4th be with you. Oh, I had to throw that one in there. There we go. My name is Brian Callanan. I'm the founder and executive director of the Cystic Fibrosis Lifestyle Foundation. And we are an organization focused on helping the cystic fibrosis community live stronger and longer through achieving healthy and active lifestyles. Since 2007, we've been assisting the CF community with recreation grants toward overcoming financial barriers associated with exercise-related activities. And since then have awarded more than 1,600 recreation grants totaling more than $800,000 in assistance. And with the transition of the COVID pandemic, we have been building our online resources, enabling people to receive help with in-home exercise equipment, as well as access to online exercise platforms. But we also have built the STROLO University as a program to help with the mental well-being and physical activity of bringing people together during the quarantine. So this semester we have built into the STROLO University more educational opportunities, including this CF Practitioner Quarter, along with professional development for people with CF transitioning back into the workforce, as well as CF research updates on some of the new and up and coming promising treatments in the pipeline for cystic fibrosis. So today I'd like to welcome the CF physicians on both the pediatrics, Greg Sawicki, and the adult, Ahmet Uluer. I've known both of you for quite a long time and really honored to know and to work with you and to have your support with the Cystic Fibrosis Lifestyle Foundation and now STROLO University. So welcome and thank you for joining us today.
Yeah, no, thanks for having us, and thanks for helping so many of our community members with exercise grants.
Absolutely, and thank you both for your help. And today we wanted to discuss sort of informally for those watching who sometimes may have questions and issues and challenges that sometimes they don't feel as comfortable talking about with their own doctors for any reason of discomfort or judgment. I don't know, but we've found that a lot of questions come through these classes and through emails and various discussions. And one of them that we're focusing on today is transitioning from being a pediatric patient to an adult patient and some of the challenges and difficulties that maybe you guys have seen over the years, but also some of the successful tactics and mechanisms of transitioning between care teams, but also taking on that role as an adult with CF. And I think everyone on the call today is an adult living with CF. So, hopefully we'll be able to chime in on some of the ways that we've found helpful of enabling a productive, healthy, and active lifestyle as an adult with CF. But I'd just like to turn the mic over to you guys and hear about some of the issues, the struggles, and success stories that you've encountered with some of your patients in their transition.
Sure. And Brian, I think you raised like really important points that I think as a pediatrician and a pediatric pulmonologist, I've been working in our CF center for, I don't know, Ahmet, how long, 20 years? Almost. I think we both started in the early 2000s.
Yeah.
At that time, we were in a time where a lot of people in their teenage years or even younger were being hospitalized a lot. And, there still are, but I think as treatments have gotten better, as the focus on sort of preventive care has gotten better, as newborn screening has taken, hold everywhere around the country, even before modulator therapy, and we obviously that has a big impact too, teens and young adults were getting healthier and healthier. And so I think that's a great thing for many, many reasons, but it really has changed, at least as a pediatrician, the in a good way, the tenor and the tone of conversations I have with parents, even when kids are first diagnosed, even when kids are babies and are diagnosed, it is we actually start talking about the adult team when a baby is first born. And that seems a little silly, like a family has a newborn with CF, they're just learning about what CF is. But the way we introduce our CF care is, this is what we do for your kid when they're a baby or when they're a toddler or when they go to school. And then when they grow up, they're going to go to school, hopefully get a job, start a family, have a life, move out of the house, develop hobbies. And guess what? We have an adult program that we work with really closely. And this is a family, but it's that expectation that we set almost from the beginning, which I'm sure others who've lived through this experience, is probably a conversation that your parents probably didn't have when you were 2, 3, or 4 years old. But we sort of set the stage now really early on to say my expectation as a pediatric CF doc is that my patients will be living and thriving well into adulthood. And my job is to help their parents understand that, and also help their parents and families and support systems understand how to sort of make them learn about their condition and learn how to take care of themselves. And so, it starts from day one. And in some ways, the conversation has become much more challenging too, because as people are healthier, they're not seeing us as much. So when teenagers were in the hospital, you could spend a lot of time sort of talking and thinking and understanding their lives and, really trying to troubleshoot some of these issues. But now with healthy teens and healthy young adults, we have sort of 3 or 4 times a year where we're really focused on this. And I think, again, it's a blessing and a curse. But I think the big message is that, this is something that CF doctors think about from the day a kid is diagnosed, and it's something that questions should come up, and the expectation should be that you're going to be finding a way to survive into adulthood, but not just survive into adulthood, but live essentially good life where you have expectations to get a job, start a family if you want to, go to college if that's part of your goals, start living somewhat independently if you can manage it. These are the kind of issues that we talk about. And now with modulators, the game has even changed even more. And so I'll turn it over to Ahmet, but I think the important thing is that this is a topic that we as CF practitioners think about all the time.
Yeah. Greg, you like summarized it perfectly. I was going to say, we have these webcasts that we provide, just much like you, Brian, for this community here. We provide it for our own community, and we've introduced the AARP. Came to one of our last webcasts to talk about retirement and financial health, because our expectation is that you're going to be working and you're going to be retiring, and then you're going to need some money saved up to enjoy retirement. So that's the modulators are really changing that dialogue. And another couple of things I'll add to what Greg mentioned is that even though we're doing well and everyone's feeling better and the life expectancy improving, and the changes and the sort of the problems that can happen with your health some occur at that young adult age, where and this is a topic that Greg is very familiar with, where and he's working on a big group on this with the STRC at the CF Foundation, is the young adults stop doing their therapy, stop doing the sort of the preventative measures, and they see their health decline. And it's right around that time they're landing, with an adult provider. And if there isn't a really great transition process, and there isn't a great communication between the pediatric and adult providers, the health of that young adult can really deteriorate during that really vulnerable time, where they're really pushing back on their disease and pushing back on, wanting to do their chronic therapies. And what's really great about our program, we did it the wrong way and then we did it the right way. When I first started, we had there was a mandate that we needed to move all the adults all at once, and that wasn't a great way of doing it, and we had a lot of pushback. And then together with Greg, we went through a process of putting together a very thoughtful transition program that is really, I think, the ideal, that we could come up with. And now we really have this seamless transition. And when that's in place, that process can be less anxiety provoking and really work perfectly.
And I think, again, adult CF care is not just about what hospital you may need to be in if you need to be in the hospital. It's actually, that's like the least important part. It's really about connecting with a new care team, which can be really challenging and scary. It can be about going to a new clinic that hasn't known you since you were a baby. It can be about asserting independence from parents or caregivers who have been doting or hovering or helicoptering your whole life. And I think that's something that we as pediatricians really do take into account. And right now what I do, and I sort of, with any patient of mine who's a teenager, usually starting at around age of 12 or 13, I say to the parents during the visit, I always want to spend at least a few minutes alone with your child. And usually the teenager looks at me like I'm crazy, like why would they want to do that at first. But I think it opens up then several years of sort of expectation that I'm going to have time to speak and answer questions that maybe can't be asked or shouldn't be asked or won't be asked in front of a parent being there. And it's been amazing to me, the kind of questions that come up. The questions that come up around fertility, around sexual health, around nutrition, around healthy lifestyles, around bullying, around taking their meds. These questions that are probably there on everyone's mind, but they don't necessarily come out unless you give them an opportunity to be asked in a safe space. And I think that's it takes effort to have that. And I actually think if a teenager doesn't have that space, you're not going to get the answer and you're not doing a good service. And I think that's the best way to prepare someone, because ultimately, you need to have someone advocate for themselves and their health. And then, of course, the communication's key. If I uncover a problem that I can't figure out the answer to, I mean, Dr. Euler and his team are there, around some of the reproductive health issues or some of the other issues that, quote unquote, might be more adult. They may or may not be, but I think it's again teamwork that helps, and communication that helps.
Yeah, I think those points that you make, both of you, are so on point and really resonate, for at least me, on the call. I'm sure for all of us. But some of the points that you made that really struck a chord were, that setting expectations really from day one of diagnosis, whether that's a newborn or at 5 years old or 10 years old. But like you said, that wasn't a conversation in my generation that happened. And that the conversation was very different about what short life expectancy a parent should be thinking about. But I was lucky enough to, in the CF center where I was being seen in New York City, there was an adult CF doctor. So he wasn't treating adults with CF. He had CF and was a doctor. And again, this was before the days of infection control and multi-resistant bacteria precautions. So today, I think it would be a very different story to have an adult doctor with CF seeing CF patients. But it really opened my eyes to the ability of someone with CF to live into adulthood and to have a career. And I remember being very young, and him, even though he was not the caretaker for my brother and I, would still take us into the weight room at the hospital and teach us some specific exercises that helped him posturally or airway clearance wise. But just that relationship of I guess opening our eyes to a broader horizon, that although statistics said maybe we were only going to live till 10 or 12, seeing that was only a number, that was only a statistic, and that there was potential for living beyond that. And again, professionally, if he could be a doctor, really, we could do anything we wanted professionally.
So
I think that's so critical.
I'm curious, when you see a new patient, a new adult who is new to you, even though we've talked about him, what are the things that you do that you think are different or that are sort of, how do you welcome an adult into the adult care model?
That's a great question. I mean, one thing is, in pediatrics, there's a lot of partnering with the families and patients as well as they're getting older. But we really, and I can tell when, someone is coming to our program who has really had the chance to become independent and self-advocate. And then we know those people who really have struggled with that or weren't given the opportunity. But the one thing I'll say is that we partner with that person, and then that person really becomes part of the care team. I tell them that they're an equal partner in deciding sort of the path of our recommendations and treatments, and they're going to be part of the decision making. So one, we share with them sort of our model of care, but make sure that they know that they're included. And we may sort of spend some time trying to understand exactly where they are, and as far as being prepared to be in an adult medical system, and we'll maybe go over a little bit of their knowledge on where their disease is. We definitely, we've over the years developed a clinic form that patients get that actually lists out all the different things that we think that they may want to know about that we may not have time to discuss, where they can sort of choose from that menu of items of what they want to talk about. And the very first thing, and that was as far as setting the tone is that we make sure that, what do you want to get out of this appointment, and the next several appointments, the next few years, of what are your goals? And so we try to make sure that we are helping that person achieve their goals. So I think the main part is that we partner, and then we set expectations and goals based on sort of that initial meeting and discussion.
Yeah,
And then,
I like the Ahmed. I think that it's like all the P words: preparation and partnership. And that's sort of what we need to do, right? My job is not to prepare you. My job is to help prepare a teenager, not to make them perfect. Think about, like, if I had to wait for everybody to be a perfectly capable adult before they saw the adult team, I would never transition anybody. I mean, if you think about the first time you go to college and you're doing your laundry on your own, you probably mess up and you don't know what to do, or you forget the quarters. I guess people don't use quarters anymore. But like the first time you have to cook a meal for yourself and no one else is there, or you move to an apartment and it could be you're 26 and you're the first time you move out of the house. That doesn't mean you should be staying with the pediatric team. If you're, even if you're living at home, there are times where you move over to the adult team and have the adult care model. And so it's not about an age or a set time, but it's about sort of this period of time where you're learning new skills, you're engaging yourself more in your health and your life. And I think that's why this partnership is so important.
No, and that's exactly it. Like we take the baton, but it's really, we're still working on transition skills. I mean, that can last for a very long time, or for the lifetime of a person. So that's definitely that's definitely like exactly what Greg you said.
How might you describe the difference between your models? And I think back to my own experience of transitioning, and it was right at the time that the CF Foundation was instituting adult care models. And so, I kind of bounced back and forth a bit between becoming an adult, going to a new pediatric doctor when I moved to Vermont, finally feeling as though I had trained the doctor on my regimen of care, and then transitioned to a new pediatric doctor before transitioning to an adult physician. So, I think from what I've heard from a lot of other patients in the community, they may not have the luxury of doctors like yourselves that are progressive and realistic in understanding the needs of adults and how that differs from children. And so I guess in my mind, Greg, I might think that, as a pediatric doctor, a large part of your role is in teaching the parents and training the parents about schedules and regimens, whereas that might be different of your relationship of understanding where the patient is at and kind of adjusting your management to their individuality. So I don't know if you guys can talk about how, what's the difference of your approach?
I don't know that we are that different. And I think you're right. There are people around the country that may be less sort of able to devote the time to CF, particularly on the adult side, where there's fewer and fewer adult specialists in certain parts of the country, that's for sure. And I think that what it gets to is really the importance of, identifying in your network who you can sort of trust. It may not be always a CF specialist. It could be a social worker. It could be a mental health professional of other sorts. It could be a primary care doctor. I mean, there are certainly parts of the country where primary care doctors are, they take care of a lot of young adults with chronic conditions, not just CF, and they actually can help be a part of the team. So I think, learning what your local resources are is really important. And ultimately, I think that, pediatricians have learned a lot from adult physicians in the sort of talking to and sharing decisions with a teenager is just as important as it is with a parent. And a lot of pediatricians maybe weren't trained to do that. But I think that's one of the messages when I talk to trainees and other pediatricians about this. It's really about, this is actually about instituting a different model of care for you as a pediatrician, and not just sort of saying, well, the adult world is different, because that sort of like puts the blame on the adult side, which I think is not always fair.
Mm-hmm.
Yeah, I think one of the most important things is to have the pediatric program actually not be critical of the adult program and set expectations in a way that, for failure, because sometimes that happens. For the, the person who may be cared for by a team, they feel like they're not sort of seeing eye to eye with, or may not be, sort of thinking about in this more holistic approach potentially. I mean, what's great is that these forums, like what you're holding here, like the different ways that CF patients with, in social media are able to get together and really understand, what their need, like they may like come across some ideas that they didn't realize that then they can bring to that CF program, that CF center, to their doctor, to their nurse practitioner, the social worker, the multidisciplinary team, and be able to sort of bring what they're learning from such forums to their care teams. But you're right. Like, I mean, Greg and our team, we're not really that different. We have a multidisciplinary approach. We have a partnership approach. We include many of our patients and families, and actually in some of our committees, we have the parents also still giving their input and involved in some of our projects. But it's it's one of like empowering and just making sure that that we have that sort of that model of care, and everyone in our team sort of buys into it.
I think in terms of skills, right? I mean, for those people listening, I think you want to think through in your course of your life, what do you expect to do? What do you expect a 10-year-old to really know? We don't want to over plan either. What do you expect a 15 or 16-year-old who's just getting a driver's license? If they can get a driver's license, they probably should be able to do a couple other things, like maybe clean a nebulizer. If you can operate a car, you can probably operate a neb machine, kind of thing. But at some point, when do I expect an individual to understand health insurance? There are a lot of adults who don't understand their health insurance. That's not necessarily, that's a skill that's going to be on these lists, but it's maybe not that important. But understanding, how to get a refill or what a prior authorization is, that's a skill that we could start teaching earlier, for instance. But I think you'll see there's all these checklists around, readiness for transition. And some of them are very basic things, like, do you know how to contact your physician or care team? Do you know what to do in an emergency? Do you know what the names of your medications, your allergies? These are the kind of like skills that you'll need. And then there's like sort of transition skills 201, which is, navigating health insurance or navigating employment or disability benefits, if that's something you need to do. Those are, and the teams are built for that. And I think, but I think we need, I think, Brian, you said it, it's about expectation setting. When a kid goes to school, they sort of have expectations for their core minimum competencies. High school is the same way, college, vocational training, a job. And so I think we as CF clinicians can help sort of orient families to say, what do we expect people to be doing at different stages?
Mm-hmm.
Another thing is many of the educational sort of opportunities were made for parents, or that the child was too young or wasn't paying attention. So when someone does come under our care, we sort of revisit some of the things, like the basics, like not just being able to clean and do those things, but why are you doing your mucolytics? Why are you doing chest PT? Do you know about infertility and reproductive health issues? Because these are things that the parents may have learned early on and just never came up later on, and just wasn't one of those things that that someone may have had time for in a pediatric clinic. So we kind of go through a little bit of a CF 301 perhaps, and then maybe touching back to 101, and then there's a lot more that we can talk about here about, and maybe we'll get to that, but just sort of the things that there's a lot of things that are different about so how we're approaching just their care as we go forward, the screening, the preventative stuff, that's a little bit different than from the pediatric world.
You touched on some great points that I really wanted to get to today as well. So I guess I'll throw two of my questions out there that may kind of weave together. But one is, what level of collaboration? So once someone transitions to adult care, and the family, the parents, you as providers are kind of realizing that they're sort of digging their heels in on not wanting to take on that responsibility, and they're not really stepping up to take on their own care, and they're not becoming empowered or accepting that level of responsibility. You know, in a school setting, you might find that they're being held back, but in a life setting, you're still getting older. You're still being moved on in life. So what are, you know, I'm sure you guys have seen this before, have dealt with it before. What are some of the ways that you would address this, or do you know, is it just an adult care provider, you know, challenge at this point, or does the pediatric team follow up with care and work on it as a collaborative approach? And are there words of advice that you have for those people out there that might be in this boat?
I think it's both to some extent, but I think, as I said, the pediatric team is not the job is not to sort of say, you graduate from us, you're perfect now, go forth and conquer the world. It's really a, you know, this is just another developmental stage, young adulthood in particular. And I think, you know, neuroscience tells us that our brain develops, you know, into our 30s. And so, and then there are new problems and new challenges that a pediatrician really can't handle. And so that's why having the multidisciplinary adult team is so important.
You know, Greg, I was going to just say that we actually send people back down to the pediatric team, but I guess maybe I'm just kidding. We don't do that. But you know, yeah, you're like, you know what, you weren't ready. You're but you know, we actually have, you know, people into their 30s who are struggling with being able to take care of themselves, and so this isn't an unusual situation. And you know, there's many different approaches, and they are definitely individualized, and it may be from challenging somebody, you know, in ways to like really try to motivate them to take on some of these responsibilities. It may take an illness. It may take multiple illnesses to really get to that point. You know, we just need to, you know, be patient and help them, you know, along the way. I mean, often in adult medicine, you know, with the, you know, system so burdened, you know, the primary care provider or the adult specialist is not going to chase after somebody, and you could be lost to follow up unless you take charge of your care. So we're fortunate that we have, you know, the CF Foundation provides support for a multidisciplinary team where we're able to, you know, make outreach. And in some of those cases, Brian, we will actually schedule a patient to be seen every single week, like weekly check-ins, weekly, you know, now it's easier with having, you know, Zoom or other telehealth platform visits. We'll check in and be like, you know what, we learned this skill last week. You know, were you able to call and, you know, the specialty pharmacy and give them the address for them to deliver that medication? That's what we talked about last week. So we slowly tackle, you know, each of these issues. And now with Zoom, it's also easier to have the social worker, the dietitian, and, you know, the provider all on the same call. And sometimes we'll be able to tag team some of those issues and just continue to, you know, to work on these issues.
And I think also, again, if everyone has their challenges in taking care of themselves, it's a question of when they start impacting the health negatively. You know, so there are going to be people that are different personalities. There are going to be type A personalities and not. Like some people are just, you know, and living with CF is a, you know, is a daily chore. There are lots of things going on, and some people can be really good some days and have bad days. That's normal. That's life. But when it starts impacting health is when I think the team needs to intervene more. I mean, I certainly take care of plenty of teenagers who probably do nothing and take care of themselves, and they're somehow, for whatever set of reasons, doing well. And the same kid could be doing nothing and then be landing in the hospital every 3 months. And sometimes it's there's something they can control. Sometimes it's not in anyone's control. And we have to sort of accept that there is some randomness and things you can and can't control. But I think as a team, we have to think when someone is having detrimental effects to their health, what are the things that are leading to that? Is it just some new infection? Is it, diabetes that is acting up? Is it something else? Or is it something that they're just not taking care of themselves well?
Right. Right. We're not having weekly visits with someone who's just not doing Pulmozyme but has 120% lung function.
Right.
But
And I think in the modulator era, that's going to be even more interesting, right? Because as more and more people are on Trikafta and feeling great, we'll want them to be doing more, and they'll probably be doing less daily therapy, which is, something that the CF Foundation and others are really thinking about and studying. But I think one of the big silver linings of the pandemic has been this growth in telemedicine interventions and social media and things like this and outreach, that is being able to bring care into the home in a different way so that we can check in different ways. It doesn't always require taking a day off of work or school to come into the clinic.
Mm-hmm. Yeah. What do those conversations sound like when you are having a patient that, like, the even the weekly calls aren't getting through to them and they're not hitting that point of acceptance? Is there kind of a conversation of reckoning, like, we can't force you to do this, and these are the consequences? I'm sure those are difficult conversations, and I'm sure they're conversations that people in those boats don't want to hear. But I just wanted to ask if there are situations that you've had that you can share, or
Ahmet, I'm sure that you've seen patients of ours that, 6 or 7 years down the road, they're 25 or 26, and they probably tell you stories of like how they were terrible when they were 16 or 17 and how they wish that they were better then. And now that they realize that maybe they could have done things differently. And sometimes it does take like just maturity or age or time. And Rima, I saw you sort of raise your hand there, but I think that's more common than we appreciate.
yeah, I mean, Rima was perfect. I don't even know why you're nodding. Like you handled it just perfectly. But no, I mean, I think that time is, sometimes that's just all it is. Excuse me. No matter what we do, that person has to get to that maturity point or that realization on their own. And we're frustrated, and they may see that frustration, although we really try to just show lots of support. But those are difficult conversations. So we do have conversations about where the trajectory of health might be. We try to graphically look at the trajectory of their lung function, and state that if this continues in this way, I mean, this line can only go to one place. And so we talk about the difficult conversations about transplant and mortality. But and not everyone responds to that. So we have to just make sure that we know the person we're talking to, and we're not going to scare them into compliance. And it might actually be that their depression, anxiety is what we really need to target. To make sure that they are in a place where they can actually hear it. And the other thing I was going to talk about, like, everyone is, has different challenges, and, socioeconomically, other structural, challenges that might be in their way. And we really need to, find out what those things are before we can, try to expect them to understand, the changes they need to implement in their life. I mean, if they can't afford, the nutritional supplements that they need, or the co-pays are preventing them from, getting the medication they need, and that's why they're not being adherent. I mean, we need to know that, and sometimes they're not telling us that, and then we'll find out later, that really it's they needed that kind of outreach from a social worker, or the food insecurity issues that were getting in the way. So we the virtual visit and the telehealth has helped us actually visit patients at the kitchen table, in the safety of their environment. We actually get to see like somebody who might have everything like just perfectly clean and lined up, and then another person, you just can't imagine where that nebulizer, the neb cup is, because there's like a pile of clothes, or there's a dog chewing on some tube, in the background. So that really, helps us with, knowing, without a home visit, that's the next best thing, is to really understand what the challenges are that someone might be facing, and we'll try to be more direct about it.
Oh, and I would just add, the social determinants of health, this complexity of life, mental health screening, the CF Foundation and others have been really forward thinking in sort of incorporating that into clinical care in terms of screening algorithms, in terms of training mental health professionals, in terms of screening for food insecurity, providing resources. I mean, I think what you do at CFLF to bring forth, exercise grants and find ways to help people. These are small little ways to address some of these challenges. And I think sometimes someone is having a challenge taking care of themselves. It has nothing to do with because they don't know about CF. It has everything to do with the fact that they can't put food on the table, or they're worried about losing their job or their benefits, or they are struggling with, a breakup in a relationship, or, they have a kid and they're having childcare issues, or they're having trouble in school. And so, we recognize that, living with CF is not just about CF, it's about the whole circle. And the CF Center can't solve everything, but I think because we are often the touch point medically for people, we can at least try to help identify where the challenges are, and we can't always fix them. I mean, we could spend an hour talking about mental health and the challenges with mental health care in the United States more broadly. We could spend a long time talking about inequities, and we could talk about disparities, and we could talk about, poverty in the rural areas or living far from a care center. All these things are realities that we have to face as CF clinicians, and we can do our best. But I think, again, that's something that I think adult care programs probably do even better than pediatric programs in some ways, because of the diversity of experiences they're seeing.
And that's definitely it. And then I was going to say, we also have an ace in the hole with, Beth Suffian, who's our, the legal guru for, everyone across the country. But, that's exactly it. If someone is really, they're struggling to pay rent, they're struggling, and it's those struggles that are really leading to them not being able to sort of maintain their health. And, often we're able to find ways where someone can continue to feel like they're contributing, yet getting that support they need, through disability or some other way, in order to just sort of, maybe even temporarily, get things sort of going for them, because it is hard for us to solve all those problems, and so we sometimes have to think creatively. But Beth is a great resource, and so everyone needs to know that resource, which is really so valuable.
And I was going to say, Giorgio, you put in the chat that
Yeah.
some people don't know anything about CF. That is absolutely true. And I think one of the things we've been working with our team is providing sort of CF 101 to give to like other people, like other psychologists or mental health professionals, or other community organizations, because that is really, you don't want to tell your life story to everybody you meet everywhere. If you're like really in a place where you just want to get help with food or insurance or disability, people have so many misconceptions about CF, because the CF of today is not the CF that they Googled about. And so I think you're absolutely right.
And and then just more on telehealth, but we're able to have like sessions like this where people can come together, like you said, Brian, you got to meet other people with CF, and that was, for an adolescent, young adult, that was an incredible person to learn from. And we don't, for so many years do infection control, like we didn't have, like people just didn't have that access. And now maybe a little bit more so, people are meeting online, getting to see each other face to face. And like we have our webcast I was telling you about for our CF community, and now the community gets to know each other, and they know, they know everyone's sort of dealing with the same thing, and they're connecting separately off the webcast, but learning from each other, peer to peer. That's an incredible resource, for our, like us. We can do everything we can to treat transition, but hearing it from an older person with CF, giving that, that advice about don't do what I did, or here's how I like I'm 80 years old. How am I 80 and surviving? It's like, because I stayed busy. I kept being active. So that's, those messages really resonate with other people.
Absolutely. Do you guys have a best success story of transitioning? Whether that's I think that the easier ones are the people like Rima who do everything absolutely perfectly. But I guess, a success story of someone who really was struggling to make it, and there was maybe something that clicked for them, or that was getting over the hurdle.
Well, I think honestly, I don't know that I have like a particular like great anecdote, but I think this idea of like, I've seen plenty of teenagers that are just either unhappy with high school or unhappy with their family for whatever set of reasons, and they just sort of have this like, what do I have to live for attitude, and they look up CF and they hear about, well, I'm just going to get sick when I'm 25, like why do I bother? And I certainly had my
Would you consider that a victimized mindset?
I think a little bit. I think it's also one that is a reality for some people, unfortunately.
Mm-hmm.
And some parents actually sort of feed into it by being overprotective or not. But I've definitely seen a few of those kids where, they go off to college or they get a job, or they actually, I think the easiest is having a girlfriend or a boyfriend. I have to tell you, there's been at least 2 or 3 young adults who like maybe were like 19 or 20, and like they're almost transitioning, or they are, and all of a sudden like they don't come to the visit with their parent, but they bring their significant other, and it's like totally different. And I know you see that too. And so it's like that support system, when they find a support system that they actually connect to, it matters. And so I think that's why we try to make sure that we're figuring out what someone's support system is. It doesn't have to be your parent.
Yeah. I mean, love is a powerful tool, but so can loss can be just as bad when those breakups happen.
We have we should probably do a study of like timing of exacerbations with breakups, because I think they actually are probably correlated.
But I do have to say that having this is no pressure out there at all. Like I'm sorry to even say this, but in some cases, getting a relationship and wanting to be the best you can be for that person really changes the trajectory. And we do have I do have in mind some people who have really changed sort of the trajectory, the way they're thinking. And and we talked to them about, try not to say too much, because but like just how proud we are of just how far they've come, because seeing someone struggle and then to make it, is such a joy.
It could be a dog or a cat too. It doesn't have to be a human relationship. I think or a job. I think when people find some purpose in life and meaning, I know that there are people out there that speak about just sort of having a motivation or a purpose. And for some people, I'll bring it back to you guys in CFLF. Exercise is their passion. People that like they live for the Ironman triathlon, and that training is what drives them. And sort of having that goal is definitely there. Brian, you've lived it.
Yeah. And I think Giorgio, you make some good points in the chat here. That if things like threats like COVID that they think is a joke, it always makes me wonder, like, how much does someone really love themselves? And I've said this on other sessions too, of we all, I think, are familiar with the golden rule of doing unto others as you would do unto yourself. But I've always considered a platinum rule of doing unto yourself as you would do unto others. That we tend to treat others much better than we treat ourselves. And even the experience of having a job or a partner, boyfriend, girlfriend, and wanting to be better for them, what happens when they're not in the picture? or that job ends. And so how much are we wanting to be better for ourselves and truly loving ourselves as much as we could love someone else, as opposed to neglecting ourselves for the sake of other people? And I think, you know, for me, that's where exercise and, you know, my niche happened to be in skiing. If you asked me about basketball or football or baseball, was not the case. But when I did find something that I felt that I was good at and that I could keep up with my peers and even surpass my peers, and those relationships of trust, which I think is an essential element of relationships, you know, boyfriend, girlfriend, intimacy relationships, is that ability to trust and to also be trusted. And I think that, again, ties in with our relationship as patients with our care providers. That's trust has so much to do with open communication and honesty about what we are or are not doing, whether it's treatment wise or especially in those teenage young adult years, experimenting with alcohol or marijuana, that it like, there has to be honesty about that with your care provider. Because I think if you are not able to be honest with them, you're not really being honest with yourself. And if you're not being honest with yourself, then there's no accountability for your actions. There's no acceptance that if I do A, B, and C, that likely is to hurt my health, whether it's sitting on the couch and deciding against going for a walk, or saying, yeah, I'll take a hit off a joint. It's, you know, you have to realize that there's consequences with your decisions, as well as with your good decisions, that, you know, this being in a relationship really is working for me, or, you know, being on my own and having my own apartment really incentivizes me to keep it clean, where I didn't have that incentive when I lived with my parents. So like you said, so many factors, and especially in that tumultuous age of adolescence that has so many extra stressors that for me led to depression and such a dark hole that I didn't even realize I had fallen into until it was really at the bottom of the barrel. And, you know, that, like you said, Greg, getting to that point of, I don't even want to live anymore. It's not even worth it. But I think the value of hitting that bottom of the barrel was, it was all uphill from there, and uphill in a good way. Whereas we often think of, you know, life with CF as, you know, climbing a mountain and this lifelong uphill challenge. But again, how you view this challenge, and is it a burden, or is it a challenge that you've been given because you're capable of taking it on? And you know, that this mountain that's in front of you, it's not going to climb itself. So, you know, let's get one foot in front of the other.
And Brian, I think everything you said is so important. And I think the challenge is for us, for parents, for practitioners, for caregivers, for support people, for friends, is how do you convince someone of that? It's very hard, right? We can ask and think and tie treatment success to, you know, hobbies and habits, but, you know, I think it is about understanding your strengths and also acknowledging your own challenges. And you're right, the more honest someone is, the more honest a teenager is, and I sort of started the conversation with this, the more honest a teenager is with me, the easier it is for me to try to help them. It's not that I can help them, I may not be able to, but at least I understand where they're coming from. And I think it's true for Ahmet as well. I mean, that's, I think our biggest success stories are the ones when we feel like we actually get to know people. Like we are doctors, we are professionals, but I think the relationships where we actually can be the resource or the person to talk to, I think that's part of why we went into medicine to begin with.
Mm-hmm.
Maybe not everybody, but I think a lot of us.
I was going to say, I think you hit it. First of all, Brian, you said that was wonderful how you put that, and being like loving yourself. But I was going to say, and Greg, you're right. It is. So we try to don't come into a room you know, trying like being, you know, just like the person who knows everything and we're going to tell you. I mean, the reason why we partner people, we try to get to know them. By getting to know them, we're able to find out those barriers and then, you know, help breaking down those barriers. I think that one thing that we do well is that we know everything about our patients and we laugh with them, we cry with them, and it is, and we have a lot of fun together. And, you know, even rounds in the hospital are not, you know, aren't so serious all the time, because life is so serious. But I mean, one thing I was going to bring up is like, just how do you, you know, how do you teach that to somebody? And, you know, we have a wonderful psychologist in our division now who really is, you know, just trying to figure out ways of how do we teach resilience and how do we, you know, have people learn how to adapt to, you know, to being in the hospital, to trauma, to other things that, you know, so that they are able to then want to rise above that. And so,
And in fact, you probably know this, but the CF Foundation is about to embark on a study of resilience as well. And mindfulness, resilience.
yeah,
These are all skills that I think, and now there's some scientific data that shows that they reduce inflammation.
yeah.
And so there is probably a biologically plausible mechanism to everything you said, Brian. We just don't know enough science to understand it.
That's exactly it. And so that is what we are. So we're trying to teach that, you know, and we have people speak to it. Those who we think demonstrate some great resilience in our community speak to, you know, others in our community about that. And then I would just add one thing. I know we're running out of time here, but we have right now 11 or 12 people signed up to run the Boston Marathon, people with CF, pre and post transplant. And those are people who are, you know, trying to show that, you know, that side of themselves, that they can take on any challenge. Hopefully you hear more from
resilience. I think this one needs to eat.
Yes.
Um,
She's letting it be known. She is adorable, by the way, Greg.
Thank you. She's been
what do you mean by that apostrophe? I didn't understand her.
I don't know what she meant. I'll have to ask her later. But so Brian, I'm going to have to take off, but really, you know, this is a conversation I'm happy to have with anyone offline. People can always reach out to me. You know, I do a lot of work in this area with Ahmet, and well, I'm happy to continue this conversation anytime.
Well, I'm so grateful for your guys' time and joining us tonight and your expertise in this really difficult realm, and know that it can be done well and it can be done successfully. And I have always looked to you guys as the model of epitome of doing it well. So thank you so much for all the work you do and the care that you've provided for so many. And again, for your support of the CFLF.
Yes, thank you so much. It was so great to see both of you guys. It's been a really long time.
Great to see you. I hope you're enjoying the Rockies. I saw that tattoo on your arm.
Yeah.
Yes, and it has my 2 mutations on each end.
Wow.
I'm going to take off. Have a great evening, guys.
Thank you for the invitation. We really, really enjoyed this.
Thank you both as well.
Thanks for being here.
All right. Have a great night. And just a quick thank you to our sponsors in supporting this program, Chiesi USA, Viatris, Nestle Health Science, Translate Bio, and Kroger Health. We're very grateful for the support to make this program happen. So we wish you all a great night. And Ahmet, I look forward to seeing you down here in Florida again sometime soon. And definitely be well and stay healthy.
Thank you. Bye, Giorgio. Bye, Tiffany. Take care, guys.
Thank you.
Bye, Giorgio. Bye, Tiff. Bye, Rema. Have a good night.
Bye, everyone. Good night.